Do you have a diabetic patient or you yourself is suffering from diabetes and you don't really have in-depth knowledge about this condition? This video is for you. Join me from the beginning to the end of this video to learn all you should know about this condition. If this is your first time of seeing this page, click on the plus sign to follow or subscribe, like this video, share this video to your loved ones, and save for later. Let's dive into. Diabetes is a metabolic disorder in the sense that it affects the way the body digests foods and other materials, especially carbohydrates. So it's a metabolic disorder in which the body finds it difficult to absorb glucose into the cells of the body, so leading to the glucose flowing freely in the bloodstream and causing a sign of weakness and other signs you might be experiencing. So, this diabetes is grouped into two. We have type 1 diabetes and type 2 diabetes. Type 1 diabetes, this one is an autoimmune in the sense that it is from the immune system. Your immune system attacks the cells of the pancreas that produces insulin. As a result, the body cannot produce insulin, leading to high blood sugar levels. They fight those cells, seeing it as invaders. This makes them not to produce enough insulin to digest the glucose in the body. Then the second one is type 2 diabetes. This one is more like metabolic disorder from the process of digestion. The body does not produce enough, or the body does not even react to any sugar or glucose in the system. So, and due to this not producing enough, the body cannot compensate the glucose outside the body by producing insulin. So this leads to elevated blood sugar levels that you see. So how often does this diabetes type occur? So type 1 diabetes is less common. This one is less common. It doesn't occur most often. So it accounts by 5 to 10% of all diabetes cases. But type 2 diabetes, which that one that I said that is metabolic disorder, is much more prevalent. That's the type of diabetes that is represented in 90 to 95% of diabetes cases in the worldwide, because it comes from what you eat as a normal human being. Then the risk factors, what can pose you at risk of having type 1 diabetes. The first one is family history. The one of autoimmune it normally comes from the gene. Certain viral infection can cause it, and environmental factors may contribute to type 1 diabetes. So this one often occurs in children and young adults. This is the type of diabetes that you see mostly in young children suffering from diabetes. You are saying that, hey, this baby, why is she suffering from diabetes? This is most type of diabetes they face, because it comes from the gene. It is autoimmune. The body fights the cells that digest their sugar. So that is what happens. Next one is type 2 diabetes. So what can put you at risk of having type 2 diabetes is one, obesity. You are overweight. You don't do physical exercise. You don't exercise. Your family history. Your mother has suffered diabetes in the past. Your age. The age you are, most especially elderly, can have this type of diabetes most often. So the country or the race you are coming from is another risk factor. So another one is gestational diabetes, the one that occurs during pregnancy. This is caused by pregnancy hormones and also the placenta. So what are the symptoms of diabetes? Both type 1 and type 2 diabetes can seem the same. The symptoms are the same. So the symptoms include when you are having frequent urination, you urinate frequently, you have excessive thirst, you drink a lot of water, increased hunger, even when you have eaten, you are still craving for more, unexplained weight loss and fatigue. You are having feeling of weakness, blood vision, or slow healing sores. Maybe something cuts your hand and is slow healing. that can also be a sign. You have frequent infection. The infection that occurs as a result of diabetes is especially yeast infection, because you know that fungi breeds on sugar, so this causes you to have yeast infection more repeated. So how do you know you have diabetes? In type 1 diabetes, you can diagnose it through blood tests to measure your blood sugar level and possibly other antibodies. The test for antibodies, you can use it to detect whether there is an immune system activity against the pancreatic cells. Then under type 2 diabetes, you can diagnose it similar to that of type 1. You do a blood test including fasting blood sugar and oral glucose tolerance test and A1C test. That's the test they are using to diagnose this type of diabetes, which measures the average blood sugar level over past 2 or 3 months. You can check your blood sugar level, your fasting blood sugar level, random blood sugar level to pinpoint this type of diabetes. So, how do you treat this condition? So, in type 1 diabetes, you know it's an autoimmune disorder. This requires a lifelong insulin therapy delivered via an injection or insulin pump. You see those people, especially in children, they put an insulin pouch on their arm that gives them insulin repeatedly. That's when you know that this person is suffering from this autoimmune type of diabetes. So you have to carefully monitor your blood sugar levels and carbohydrate counting. Don't just eat carbohydrates anyhow. The regular exercise and a balanced diet is very essential. Like I've been telling my patients, diet is very essential in management of diabetes. Then type 2 diabetes, the treatment involves lifestyle modification. That is, you encourage yourself to lose weight if you are obese. Then you have healthy eating, regularly exercise, and oral medications to lower your blood sugar. So this one they give oral medication, but in the other type of diabetes, insulin therapy is needed. So in some cases, insulin therapy may be necessary in this type of diet, especially when the person has not been taking their drugs properly and come down with the higher range of effects on the type 2 diabetes. That is when they will now encourage insulin to reduce the blood sugar. Then complications. Both the type of this diabetes can lead to serious complication if you leave it untreated or you poorly manage it. It can affect the heart, leading to cardiovascular diseases. It can affect the kidney. It can affect the nerves, which is known as neuropathy, where when you have injury, your injuries cannot heal. It can damage your eye. It can lead to foot problem, that is diabetic foot ulcer. How can you prevent this diabetes generally? The type 1 diabetes is not preventable because it is autoimmune. It's something that comes within the gene. You cannot prevent it. But in type 2 diabetes, you can manage it with various mechanisms, such as modifying the way you live, eat healthy, exercise regularly, manage your weight, lose weight if you are obese, and also regular monitoring of your blood sugar can help you stay at your best. Diet is very important in management of diabetes and also exercise. So ensure you live a healthy lifestyle. Once you live a healthy lifestyle, this type 2 diabetes can be kept at a bay. And if you have had the gestational diabetes in the past, maybe when you were pregnant, you had diabetes, please modify your lifestyle after pregnancy. If you are obese, lose weight, eat healthy diet in order not to fall into type 2 diabetes. So, but in type 1 diabetes, why you cannot cure it or manage it, what you should do is always be on your insulin therapy, manage your diet, and the rest of them. Thank you for staying tuned in today's video. If you find this video interesting, like this video, comment on this video, share to your loved ones, and also subscribe or follow this page.